We are on location this morning here at the Vein Company in Johnson City, talking with Dr. Randall Towne about the needs that they are meeting here in our community. And Dr. Towne, thanks for having us out today.
Well, thank you for being here.
Well, first of all, tell me a little bit about the Vein Company. You guys continuing to grow and expand and seeing a lot more patients here in our area and in Knoxville.
Yeah, we are. We have 5 offices, 2 of which in the Tri-Cities, 2 of which in the Knoxville area, soon to open an Abington office. And it meets the needs of the community, in particular given the chronic nature of this disease. It's incredibly prominent. Probably 80% of the U.S. population is affected by this. 30% or so have chronic disease that has a large need for appropriate management, diagnosis, and care.
Well, tell me a little bit about the patients that you're seeing and some of the symptoms that they're coming to you with.
The hallmark of the disorder is a chronic vein disorder where the veins are enlarged, they're bulging, they create a host of symptoms, in particular lower extremity heaviness, fatigue, progressive discomfort. They tend to have symptoms of night pain. They may have irritable legs where they're jumpy at night. They tend to have large varicosities, all of which eventuate into progressive changes that limit their ability to participate in normal activities.
And you were telling me too, a lot of times they are living with this pain, thinking that it's more of a cosmetic issue, just something that sort of associating it with age, but this is something that you can diagnose, treat, and make a huge difference in their life.
Oh yeah, simple studies, an ultrasound study that enables us to determine the underlying pathology, and most symptoms are dismissed as pain due to arthritis or swelling due to weight gain, all of which are misnomers. The most common cause of lower extremity swelling and edema are associated with chronic venous disorder.
And we were looking at some of the before and after pictures from some of your patients. Just a remarkable difference, and not only just visually, but what you're doing to change their mobility.
Oh, by all means, there is a large disability factor associated with chronic vein disease. A number of folks tend to be limited from couch to chair. They have chronic symptoms, and the benefit of minor office-based procedures allow them to function on a normal basis. Their lower extremity edema improves, their changes in their pigmentation, their chronic pain syndromes improve significantly.
And a lot of times I understand insurance will actually cover this.
Oh, broad-based insurances, Medicare covers them well. A number of the commercial providers covered. And for those who are uncovered, we extend services as well.
So for someone that comes in, just sort of walk me through what they can expect when they come in on that first visit to meet you.
The initial visit is an introduction to the staff. We introduce them to our nurse practitioners in addition to myself. We determine the underlying cause of their disorder, and then we arrange for an ultrasound. They call it a duplex ultrasound. It takes about 40 minutes. Following that, I review the ultrasound along with the ultrasonographer and provide them with a tentative diagnosis. We have them return in 1 to 2 weeks, at which point we sit down with them, create a treatment plan, and then orchestrate the appropriate management.
So sort of a roadmap to get them on that back to life, the life that they remember and want to regain that independence a lot of times.
Oh, by all means. And the procedure itself is brief, takes us about 20 minutes. It has no post-operative limitations. Most folks we encourage to get out, walk, spend as much time as they can ambulating.
Has to feel good knowing you're able to really make a difference in someone's life.
Yeah, it really does. It has a significant import. And a number of folks just return to a normal lifestyle within a very short period of time.
All right, and you're going to be opening up in Abington coming up in just a couple months?
Yes, probably early March, mid-March, we'll have our office up and functioning. Thereafter, we can manage the community as well.
Well, thanks so much for having us out,
Well, thank
learning
you.
a lot. If you have questions or you would like to get in touch with them, once again, you can visit their offices in Kingsport or in Johnson City. And don't forget, they will be opening up soon in the Abingdon area as well.